I'm Dr. Jyothi from Kolar. Sir, I'm going to ask you about little practical doubts which I'm facing in my OPD. Like always, I find like during my embryo transfer time, the hazy triple lining and triple line will not be good.
Very good question.
And after doing hysteroscopy also, and again it will be the same thing.
You use the word always or frequently. Hazy is not
hazy.
right. Hazy is
Okay.
not. First of all, understand what does hazy
Not a
mean?
good triple line.
What does a hazy mean?
Not
Hazy
clear.
means it has become whitish, and when will become whitish when it is under effect of LH and progesterone. That is not a good thing to do, because when we start a cycle, body should not have any progesterone.
That is true.
It should have, but it should have less than 1.2 or 1.3 nanograms per ml, right? Itna theek hai beta.
Yes.
The margins of the endometrium should be pencil sharp margins. The center line can be thicker white and outside two white lines. Are we here okay? What you should do? What mistake we people do is that we assume that we give somebody progesterone for 10 to 12 days, then we call them, estrogen for 10 to 12 days, then we call them for an ultrasound. So what we people are doing is 2 milligram TDS of estrogen and come on 12th day. Many people do this. I believe in sequential. So I write 2 milligram BD for 4 days, 2 milligram TD for 8 days. Come to me on 12th day. I've been doing it for a long time. But now what is happening is there are so many brands coming in the market. And I'm also finding that large number of women, they are hyper responding to the estrogens. Reason I don't know. So find that on day, and they call them on 12 days of drugs, their ETs become hyper hazy. But ET has to be triple layer, only then it will become hazy.
Yes.
So what you should do is call them on 9th or 10th day. That time you will maybe having a thinner ET but with the sharp margins. Make the ET grow in front of you. And when ET is touching around 8 to 9 millimeters, so I normally do transfers at around 9 or 1 centimeter endometrium. My cutoff will be around 7.5 to 8 millimeter. So haziness will come when you delay your ultrasound or she's already becoming utilized. So 8th, 9th day, we call that patient. When the lining is around 8 millimeter, 9 millimeter, look at their color flows, and very important is doing spiral artery RI and PI values and do their P4. How do you know that endometrium is becoming bad? Their outside lining will become hazy ashes. This is actually a big problem. A lot of young people are coming with this because they have learnt a protocol. Do this. But they are not able to tweak the protocols. आपका protocol क्या है वैसे? After how many days you call that patient?
Sir, eighth day I call them.
8th day call them?
8th day, sir.
What dose are you giving to them?
I'm giving TID dose.
So she's giving 10 milligram TID. He's giving 6 milligrams per day. So you're calling them at 8/6 ka 48 milligrams ke baad you're calling them.
Yes.
So what I suggest is, in case of finding this problem, it should happen on 8th day. They normally don't become hazy. In case it is hazy, I think you can try to change and how much is the endometrial thickness in your case? ET कितना रहता है?
Sir, 9 to 10, but it is very.
But it is very high, na? 9 to 10
Yes,
is a high
Even
endometrial.
8 also.
So I suggest you change the brand of your estrogens. Give 2 milligram BD for, it's called sequential. One is continuous.
Yes, sir.
See, body doesn't form 6 milligram of E2 every day. So body gradually goes into high levels of E2. So give 2 milligram BD for 4 days.
4 days.
Then give 2 milligram TDS we give for 8 days.
8 days.
So give first 4 days, give 4 milligram per day. And then you give for 4-5 days 3 milligram, 6 milligram. And then you do the scan. नहीं होगा.
I have started changing to that protocol, what you have said.
Yeah, the sequential protocol.
Yes, sir.
And sometime, Jyoti, The issue is with the hormones. I'm telling you that, sorry, many times, many times it happens, and you keep changing between Endofertach,
Yes, sir.
Isravet,
Proganova.
Proganova. Some brands, they start giving sudden surge in the ET values. We don't know why it is happening. So now people are shifting towards those lovely gels. Gels are more,
Gels.
gel has got more proper absorption, the transdermal absorption, than oral. But I think so, अगर ऐसा हो रहा है, it's a common thing which is occurring with the people nowadays. Go sequential and go and call them on 8th day, it won't happen. And try to shift to
Brand.
sprays.
Sprays.
No, sprays. Where are the sprays? Who is going to show me the sprays? Sprays. Sprays are a very good thing to use. So we've spoken about, it is an 80-gram spray and 1.5 milligram is approximately one spray. Titrate, and we have learned how to give it. So who's going to demonstrate to give?
I didn't see yesterday morning.
तुम कहाँ थी? To demonstrate on her then. Done. So take the mic from her and demonstrate. How do you?
Hello, Dr. Vidya. I'm actually having failures of endometrial thickness formation. So I have been using estrogen oral preparation. So what is the next chance? I mean, how can I prevent this haziness of my endometrial preparation, and also my lining is not properly forming up to the mark?
Okay, I'll have to. Okay, Suprita, don't worry about it. Let me look into what kind of estrogen you were taking at what dose. And thing is, see, we can use alternative kind of preparations of estradiol. Many different forms are available. Oral preparation. There is also a vaginal
Yeah,
preparation
actually,
that is
I'm using
available.
oral preparation.
Okay, there is a vaginal preparation that is available also. And this one, what I'm having, it is a estradiol gel. This is a transdermal gel what we apply over the skin, and it gets absorbed through the skin.
Okay.
So each pump of this is going to give approximately 1.5 milligrams of estrogen. So we'll be putting you on some an estrogen dose of 2 milligrams morning and night, and for the first 4 days, followed by 2 milligrams morning, afternoon, and night. That's thrice daily. So you will have to.
How many days?
So we'll put you on this for 12 days, and on the 12th day we'll assess your endometrium.
On
And
12th
then-
day, I have to come for scan, or before that?
Yes, maybe prior also. I'll see you in between, since you have already had a
Failure
some
of IUD
difficulty
formation.
in the endometrium. Usually we would see directly on the 12th day. Since you have had previously failed formation of endometrium, we'll also assess you in between
Okay.
to see how you're responding to this particular
So I
preparation.
have to apply this 2 times daily for first 4
Yes,
days.
for the first 4 days.
Okay.
So each
I have to
time,
apply it on the skin?
each time, each pump is going to give you about 1.5. So 2 pump this way. Can you
Yeah,
show your
okay.
hand? Let me demonstrate. So,
Just
3 times.
shake.
It's a pump.
so that's 1 pump.
Okay.
There'll be 1.5,
And the pump.
2 pumps. So
Total,
and then
you will be covering 3 grams totally.
yes,
Milligrams.
just 3 milligrams.
3 milligrams,
3 milligrams. Just apply it over your hand.
I have to leave it.
You have to leave it until it dries off.
Okay.
Then we will take one pump on a evening.
Yeah.
So now let it be there.
1 pump in the evenings.
1 pump in the morning, 1 in the evening. 1 pump is approximately
1
2
point.
milligram,
2 milligrams.
1.5 milligram. So let it dry now, and then don't rub it.
I am
don't do the
already
sun.
having hormonal issues.
If we make chili feeling. Good. Take a tissue from me.
Yeah.
Yes.
Sir, eight for same person.
1 pump morning, 1 pump at night.
If you want to increase the dose, afternoon,
Take 2 pumps. Take 3 pumps. 1 pump is 1.5 milligram. You can- you want to use.
So